Hi everyone, this is Dr. Merhaut from Elite Sports and Spine Chiropractic. Welcome to this week's Elite Education Series. I'm going to be going over some foam rolling techniques for mostly the lower extremities. This past weekend we put on a running clinic that a lot of people enjoyed, and one of the things we did go over was proper foam rolling techniques. So I'm going to be going over that mostly through the lower extremity. This is just a global foam rolling session that we'll be going over, so not necessarily specific for any injury, but it can be used as part of your dynamic warm-up or also part of your cool-down. So foam rolling is good both prior to exercise as well as post-exercise. So I'll be going through some things, starting up through the hips, working down into the hamstrings, as well as the sides of the legs, so through the IT bands, into the quads, and then a couple areas that some people tend to neglect when they're doing foam rolling. So that including sometimes the adductors. We'll talk a little bit about the tensor fasciae lata, which is the muscle that partially goes into the IT band. So if you have a tight IT band, we'll talk about where you should also focus in on foam rolling those areas. So to start things off, we'll roll back a little bit. We're going to be doing the hip first, so we'll just have you sit straight on the foam roller. The leg that we're doing is going to be straight, the opposite leg, whichever is more comfortable for you. It can be here, or you can even cross it over towards the top. And then we're going to just use kind of both legs to go back and forth. This gets the side of the hip. Oftentimes people have tightness through the piriformis muscle. Some people have sciatic-like symptoms due to tightness in the piriformis muscle. So by rolling this area out, it'll be pretty tender. Usually what I'll tell people is find a spot that is really tender, sit into that spot, put all your body weight into it, and then back and forth about a half an inch or two until that releases a little bit, and then even you can go forward and backward onto that spot as that releases as well. Next, moving down into the hamstrings. So you can do both legs at the same time. If you want to intensify it, then cross one leg over to put more weight onto it and work through the hamstring all the way up to the ischial tuberosity, which is the bony part of your butt that most people sit on, and then all the way down into the knee, working all the way through that muscle. There are multiple parts of the hamstring, so you want to make sure you get the lateral, the outside part of that hamstring by rolling out, as well as the inside portion of that hamstring by rolling inward. Next, to move on to the outside of the leg, which a lot of people will do for IT band relief. So we will start similar position that we did with the hip, but this time working down. And I'm going out of the screen, so I'll start down through here. Down all the way into the knee and back. The tensor fasciae lata, which is the muscle I mentioned previous, that goes into that IT band, is localized. Basically, if you take the bony part of the front of your hip and the bony part of the side of your hip, and you go right in between that area, then you'll get that. So kind of more in the front of the hip. Most people will neglect this area when they're trying to loosen up that IT band. Same concept, finding an area, holding it into that spot, and then rolling back and forth until that releases a little bit. Next, moving on to the quads. So front of the hips, right through here, or front of the legs. Going on the forearms and then back and forth. Again, just like the hamstrings, there are multiple areas of the quad, so you can roll from side to side to get the inside and the outside of those quads, both ways. And the next one that is often neglected, which is tightness through the adductors. Sometimes people that have a problem with their squat can be due to tightness in the adductors. It could also be due to tightness to the hamstrings, different muscles like that. But one common area we see people neglect is the adductors. This one is a little bit tougher to do, but you're going to have the leg you're doing is going to be straight and working through the inside of that leg. So just like this. All right, and then moving down past the knee, so we'll go into the calf muscle. So both legs at the same time, or to intensify it, doing one leg at the same time. Also multiple parts of the calf, so the gastrocnemius as well as the soleus muscle. You want to make sure you're getting both the inside and the outside of those areas. If you You want to get towards the outside, which are the peroneal muscles on the out, going through the side. And then also another really tight one that a lot of people don't do is right through the inside of the shin, or even on the top of the shin, tibialis anterior, tibialis posterior, the medial aspect of the soleus, all those right through here. And then rotating in and out, just like we did with the other portions of the leg. And I think that's just about it. So those are generalized foam rolling technique. You can use that prior to a workout as well as after a workout. It should take no longer than 5-10 minutes if you're doing it properly. You'll notice the areas that need a little bit more work, those tight areas. So if you have any questions or you feel like anybody will benefit from this foam rolling technique demonstration, feel free to share it with them. Next week we'll go through some foam rolling techniques for the low back, mid back, as well as upper back into the neck and suboccipital region, and then potentially some stuff with upper extremity foam rolling, which most people usually don't incorporate as well into their techniques. So this is the Elite Education Series. I'm Dr. Merhaut. I hope you join us next week.